Good morning. Today is the day of my gestational diabetes test, the glucose test. My appointment isn't until 1, which I usually schedule my appointments in the morning, but I intentionally scheduled this one later in the day so that way I would have time to like have breakfast, have lunch, eat something. You're happy? Oh. So, I'm sorry, baby. Anytime I eat something that's like way too sweet, I already feel like I'm gonna die. So I'm going to try to make sure that I eat, I don't know, I'll have like avocado toast maybe and scrambled eggs right now for breakfast. Or I may just go get something from Starbucks. Okay, so I'm already changed to head to my appointment. I just coughed before starting this video and I'm pretty sure I peed myself. So I'm gonna have to change. Right now I just need to wash my face, do my makeup, and then go drop off my son at his babysitter's. This happened to me yesterday right before leaving the house. So I was strapping my son in his car seat and I sneezed. And then I had to go back inside and change. Bye bye.
Bye bye.
I love you.
I love you.
I love you more.
I love you more.
Bye bye.
Bye bye.
Besitos. Okay, so I'm just realizing that my appointment is in 15 minutes and I have to be there for at least an hour. They make you stay for like an hour after taking the glucose test, and I'm realizing I'm gonna pass out if I don't eat anything. So I had to stop at the Wendy's really quickly. There's a huge line for the drive-thru, so I'm just gonna go inside and just get some french fries or something, because if not, I'm gonna be shaking and throwing up and crying. Bad news, their dining room is closed, so I have to go through the drive-thru. But thankfully, my doctor's office is right across the street, and it's 1:04 right now, and my appointment is at 1:15. And honestly, I don't care if I'm a few minutes late, just because I know I'm gonna be there so long, and I'm not taking the risk. I just ate my french fries like a feral animal. I have 2 minutes before I need to go in. There's someone parked next to me with tinted windows and they're probably like, is she okay? I'm not going to take the camera in, so I'm going to take my phone and then maybe I'll be able to record a few clips. With my son 3.5 years ago when I was pregnant, I came out shaking. I was about to pass out. I had to have my husband come pick me up. So hopefully this time is a lot better because my pregnancy is a lot less difficult and I'm not having as many issues. Hopefully it's fine and it just tastes gross. Okay, so I just did the glucose test and now I'm gonna do like my routine checkup and then need a urine sample. Okay, I'm finally finished. I'm shaking. I'm gonna sit in the car and drink water for like a few minutes and then I'm gonna go get something to eat. It wasn't as bad as I remembered it, but it was a little different because I remember with my son, this was 3.5 years ago, they gave me the drink and then had me go to the lobby and I was able to drink the drink there during the 1 hour. And I remember that time, it could have just been because of like my very bad pregnancy, but I was on the verge of like passing out. I was shaking, which is very dramatic. I'm not saying it was because of the drink. I could have just maybe not have been feeling well that day. So they had me wait in the room this time and then the nurse was like, you have 5 minutes, and I was like, 5 minutes? Last time they let me drink it within the hour of you waiting. And then she's like, oh, maybe they probably did, it just depends on like who the nurse is, or I don't even know. But then she said we have to watch you just to make sure you finish it within the 5-minute time frame. They had 3 flavors: fruit punch, orange, and like strawberry lemonade. And I picked the fruit punch and it tasted like children's cherry Tylenol. So it was just really gross, and it was obviously very, very concentrated sweetness. So I tried to chug it as fast as possible at first because I knew my body was going to refuse the drink. And then I started feeling really sick and she's like, you're okay, like you can take your time, you have 5 minutes. And then honestly it just felt awkward though because the nurse is just sitting in the room with you to and it's like really quiet. So I was trying to make some conversation, but then I was like, you know, I'm just gonna finish it. And I asked her, is it okay if I just chug it? And she was like, yeah, you can. A lot of people do that. And then they had me go wait in the lobby again because I was going to do my routine prenatal checkup, my 25-week checkup with my OBGYN. And that went really well and really quickly. They just had me take a urine sample where they check for like protein. Then the doctor came in, measured my stomach, they weighed me. I got to listen to the baby's heartbeat, which is my favorite part because like, you know, you're pregnant and you feel the baby move, but it's like hard to believe that there's actually like a different set of body parts inside of you. So every time I hear the heartbeat, I'm like, oh wow, I'm actually pregnant. It's hard for me to like register that like I'm pregnant. Like I look pregnant, I feel the baby, but when you hear the heartbeat, it just feels a lot more real. Oh, and I weigh 131 pounds. And whenever I started off this pregnancy, I weighed 115. So I'm already up 15 pounds, which isn't a bad thing. It's normal. A lot of it goes away after the baby's born. My boobs already doubled in size, your placenta, amniotic fluid, the baby, your uterus. I have 15 weeks left to go. So anyway, after the prenatal checkup, they sent me back to the lobby and I had to like finish waiting the hour before they have you go back to draw your blood. That's whenever I started feeling bad. I started like shaking, and I think it's worse because you're sitting down. If I had been like up, moving around, but I could feel my heart beating out of my chest. I was trying so hard not to fall asleep or look like I was not doing okay, but I was kind of just like dozing off. I could hear my heart everywhere. I had my fingers here. I could feel the pulse. I'm about to go pick up my toddler and go on a little coffee date with him. But honestly, I don't want anything sweet. I just want water. And I got this really cute tumbler is what it's called at Target. I don't know how much it was because I didn't check the price tag, but I've been drinking so much water these past few days. As long as I have a cute cup, you can catch me hydrated. Oh yeah, once I finished the hour, they called me back and then I got just like a tiny tube of blood drawn. They'll let me know my results on Monday, I think. And if you pass the 1 hour test, which was the one I just did today, then you're good to go. But if you fail, then they have you do the 3 hour test. I didn't have to do that with my last pregnancy, but I kind of just like compare things to my last pregnancy. Even though my pregnancies are completely different, I just feel like if I was fine my first pregnancy and that was like a horrible pregnancy, I feel confident that I'm gonna pass the test. I really want to treat myself though, because I get so much anxiety before coming to the doctor's office, and it's not because I'm worried if the baby's okay or not. I just, in general, having to go get like checked. Like tomorrow I have to go to the eye doctor and then redo the eye exam for like contact lenses. I need more contacts. I'm trying to be a baddie this summer, and I can't be a baddie with these glasses. My vision's blurry right now, but I look better this way, so I'll be blind just for the video, but as soon as I start driving, I'm gonna have to pull my glasses back down. I'm gonna go get like a refresher from Starbucks and like a breakfast sandwich maybe. Okay, so I got the mango dragon fruit refresher from Starbucks without the dragon fruit, and I'm sad because I thought it would still be pink, and that's the reason I get it. It tastes good, but because it's pink and pink things make me happy, so it's depressing, but it tastes good. Hi! Okay, so I'm gonna show my toddler where they drew blood for me because I let him take the bandage off because he thinks he's like a little doctor. Me quitaron sangre. Ha, me quitaron sangre, me duele. Ayúdame, Dr. Omar. ¿Qué pasó con mamá?
This is a band-aid.
Un band-aid. Más que me dieron green y yo quería pink.
Just want pink.
Sí, quería pink. Me quitaron sangre.
¿Quieres el green?
No, no me gusta el green, quería pink.
No, sí quieres green.
Sí quiero.
¿Es el green? ¿Es el green? ¿Es el green?
Sí, hay muchos colores.
No, don't move, mommy. Don't move.
Don't move?
No, don't move.
Okay. Ouch!
Don't move. Mami, no duele.
Sí, duele.
No. No. Quítalo tú.
No, ok, ayúdame. Ya no voy a... No duele. Dale. ¡Ay! ¿Qué es eso? Ew.
You.
Sangre.
Un sangre.
Ouch!
¿Cómo que te toca?
Ahí me quitaron sangre, ¿ves mi bubu out? Sana, sana, culito de rana, si no sana hoy, sanará mañana.
Mamá, esta lo acuesta.
Échale agua.
Sí,
¿Del water gun?
sí.
No.
No, sí puede. Mamá, esta no.
¡Oh, mira el gato! Oh no! Okay, so I hope you guys enjoyed the vlog and maybe you feel a little less nervous when you go get your glucose test because I always binge watch these kinds of videos, so you kind of know what to expect. But yeah, stay tuned and thank you for watching. I'm gonna enjoy this depressing drink.